Are you concerned about the health of your intimate area and wondering about the right ways to take care of it? If yes, this video is for you. I'm Dr. Sarah, a specialist in urology and women's health, and today I'll talk about 10 things you should totally avoid to keep your vulva healthy and safe. First, don't just call it the vagina. Many people think the only important part of this area is the vagina, but actually, the whole area is called the vulva. It includes everything from the pubic area, where the hair grows at the top, all the way down to the bottom of the vagina. It has important parts like the clitoris, clitoral hood, vaginal opening, and the inner and outer labia, and each of these parts plays a vital role. If you want to get a detailed look at the anatomy, I recommend watching a video about the G-spot in women, where all the parts of the vulva are explained thoroughly. Now, if you have a vulva, I strongly suggest you grab a mirror and take a look at yourself. You can even watch the video while doing it. And for the men watching this, encourage your partners to do the same. Tell her, let's do this together. It could be a fun and exciting activity that brings you closer. And the important anatomical part to focus on here is the clitoris. Stimulating the clitoris is the most effective way for many women to reach orgasm. Second, don't ignore your vulva. The vulva isn't just a part of your body, it's a key area for your sexual and overall health. Take care of it, including how it looks and its health. The clitoris sits just above the vagina, right above the urethra, and looks like a small round button. What you see is just the tip of the clitoris, similar to how the tip of the penis is visible in men. The clitoris and penis are actually equivalent anatomical structures. If you look closely at the clitoris and examine its internal anatomy, you'll find it extends deeper inside. Inside the body, it branches out just like the penis, so it's actually bigger than it looks. What you see is just a small part of it. The clitoris is covered by a clitoral hood, which is basically the same as the foreskin on males. You can gently pull it back to clean underneath. Some women don't have any issues because they have very little of this hood, but for others, small bits of residue, dead skin cells and oils can build up under it, forming a smegma-like substance, just like in men. This can cause inflammation or scarring between the head and the hood, leading to pain, discomfort, or even difficulty reaching the area. First, don't ignore your vulva. It's not just a part of your body, it's a key center for both sexual and overall health, so take care of its appearance and hygiene. Second, never use household items or substances inside your vagina. Sometimes you hear about women using things like garlic or yogurt inside for health or cleaning reasons, but that's a big mistake. The vagina cleans itself naturally, and putting stuff in there can mess up its natural balance, changing the pH and increasing the risk of recurring infections, which is definitely something you want to avoid. The only thing inserting something into the vagina should be done with a well-lubricated penis or a safe sex toy designed for that purpose, equipped with a handle or a wide base to prevent it from getting lost inside. Or use medication prescribed by a specialist, because there's natural negative pressure inside the vagina. If you put in something small and hard to hold on to, it might get stuck and be difficult to remove. We've seen many emergency cases with objects stuck in the vagina, which shouldn't happen when you're just trying to enjoy yourself. Also, don't do vaginal steaming or use products meant to enhance appearance without any medical benefit. Yes, you might have heard about vaginal steaming, but it's not medically helpful and can even cause some problems. Irritation or chemical burns can happen sometimes, though they're not always necessary to worry about. But you can definitely keep your vulva moisturized, especially during or after menopause, when you might notice dryness in the area due to hormonal changes affecting the tissue. Just like the rest of your skin, the vulva needs moisture. In some cases, using a vaginal estrogen cream, whether prescribed or over-the-counter depending on the product, can help maintain healthy tissue, balance pH levels, prevent urinary tract infections, and improve moisture. Always check with your doctor before starting any treatment, but using vaginal moisturizers is generally fine. It's available and can be gotten without a prescription when needed. Fifth, don't neglect vaginal lubrication during sex. The vagina lubricates itself naturally when a person is aroused, but it takes time to reach that level of moisture. If you're having sex with a woman, you need to understand that she needs enough time to get properly turned on. And if you're the woman, know that the vagina won't automatically lubricate as soon as sex starts. It can take 25 minutes or more of foreplay and stimulation to get properly lubricated. So, it's important to take your time and don't get frustrated if everything isn't ready right away. Lack of lubrication doesn't mean lack of desire or attraction, might just be because there's not enough stimulation. Using a sexual lubricant is a great solution that makes things smoother and more enjoyable. I've already talked about different types of lubricants on my channel, so you can check out the video to find the best one for you. Just know that using lubricant is a smart and completely normal step. It doesn't mean there's anything wrong. It's super fun and makes sure everything stays pleasurable and exciting, not uncomfortable. Also, don't forget to play with the vulva and vaginal opening. They're both incredibly sensitive and add a lot to sexual pleasure, right? Both feel amazing when stimulated, but it's important to discover exactly what works best for you. What turns someone on might not work for you, so exploring is key. Whether you're alone or with a partner, take some time to figure out what feels good and what doesn't. This way, you can guide your partner, or they'll learn how to respond to your body without needing a lot of explanation. Sex should be fun and comfortable. Find out what excites you, what gets you to orgasm, and what leaves you feeling nothing, and enjoy that, because sex is meant to be enjoyable. 7th, don't ignore unusual symptoms. If you feel anything strange like itching, burning, pain, or pressure, you're feeling heaviness in your pelvic area, so don't ignore it. Talk to your gynecologist or a urologist to figure out what's causing these symptoms, because some issues can get worse over time and lead to more serious problems. Having sex with a partner, or even masturbating, can actually help maintain your mental and physical balance. Stress might cause your pelvic floor muscles, which support your internal organs and surround the vagina, to tense up. For example, if you have a sexually transmitted infection, it could lead to inflammation in the uterus or fallopian tubes, known as pelvic inflammatory disease. The pelvis, which can sometimes cause infertility or issues like pelvic organ prolapse, might make you feel like something is coming out of the vagina. This can get worse if it's not treated. If it's not bothering you, there's no need to worry, but if it's causing discomfort or affecting your daily life, it's important to see a specialist in urology or gynecology to figure out the right treatment and prevent it from getting worse. 8th, don't be too hard on yourself. What do I mean by that? Well, general stress in your life can seriously affect your sexual health. When you're stressed, it's hard to feel excited or interested. Having sex. Also, the vagina won't naturally lubricate itself, which makes sex less comfortable. Sex isn't just about pleasure. It has a bunch of health benefits too. It helps reduce stress, improve sleep, and can even boost heart health and circulation. So, having sex with a partner or even masturbating is really important for keeping your mental and physical balance. Stress can cause the pelvic floor muscles, the ones that support your internal organs and surround the vagina, to tense up. When these muscles stay tight all the time, you might experience symptoms like pain while peeing, or pain during pooping, sex, or reaching orgasm, and even difficulty inserting anything into the vagina. So it's important to reduce stress levels. If you're experiencing any of these symptoms, we strongly recommend seeing a specialist. 9th, don't forget to mix things up. When you're learning how to pleasure yourself, you often get used to just one way, which is totally normal. But the body can get used to that kind of stimulation, especially if you rely on a vibrator, which can't always be replicated by hand, mouth, or penis. That's why you might find it much easier to reach orgasm using a sex toy, while it might be harder otherwise. Experiment with your partner, so try mixing things up. Use your hands sometimes, use your imagination, or try different ways to stimulate yourself instead of relying only on a vibrator. But if you're totally comfortable using a vibrator and it gives you an amazing orgasm with your partner, then there's no harm in continuing. And if you can easily reach orgasm through self-pleasure but not with your partner, you can always bring your favorite toys into the relationship to make it more enjoyable for both of you. Number 10. Use it or lose it. I'm not saying you have to have sex every day, and I don't want anyone to use this as an excuse to pressure their partner into sex. What I mean is that there's a direct link between blood flow to the clitoris and its long-term health. For men, if blood doesn't flow enough to the penis for a long time, tissue changes can happen that affect the ability to get an erection. The same goes for the clitoris in women. The body naturally sends blood flow to the clitoris at night, even if you're not having sex, which is why you might notice it swelling sometimes in the morning. This blood flow is really important for keeping the tissue healthy, but if you have health issues like high blood pressure, diabetes, or high cholesterol, the blood flow to the clitoris might be affected. Over time, this means the clitoris might become less responsive, making it harder to reach orgasm. So, it's helpful to encourage blood flow to that area by having sex or regularly stimulating yourself. If you're generally healthy, blood flow usually stays normal naturally every night. But if you have any health issues, it's really important to work on improving them, like lowering blood pressure, managing diabetes, and improving cholesterol levels. Poor blood flow over many years can cause scar tissue to build up in the clitoris, making it less sensitive over time. Bottom line, take care of yourself. Take care of your vagina just like you do the rest of your body. Listen to your body, get to know it, and don't be shy about talking or exploring it. Sexual health is a key part of overall health, and having safe, enjoyable sex helps improve your quality of life.